I was on a walk yesterday, and my neighbor, without really prepping me, said, just looked at me. We started small talk. He didn't talk about our video. He just said, all the preparation I've been taking, I never once thought about taking my shoes off when I walked in the house. How about that?
That's a beautiful thing. It just makes a difference.
Yeah.
Even one person. And I pushed it when it came to what I do, but what I have to do is I do it to protect my family.
Yeah.
Um, I don't know what happens if my wife gets sick. We're in trouble.
Yeah. And then two more notes, though, coming off our first video. My mom and my cousin both went out and bought Windex.
Hmm.
So my cousin's thankful for that tip. Now, you said something after I gave you a heads up on that to add 2 ounces of vodka to the Windex. Why is that?
Yeah, if you have any strong alcohol in it, it just magnifies the effect. You're just not going to miss anything.
All right. So last time we talked was a couple days ago. Last changed. We're essentially in a stay in your house law within the state. A couple other things have gone on. I guess what I'm most interested in is my my pharmacy just shut down for a deep cleaning. Who knows what's going on there? What are you seeing with Northeast Ohio numbers?
The clustering is very typical. So in that aspect, higher populated areas, higher metro areas, Cleveland metro, Columbus, Cincinnati, you expect to see more cases in these more populated areas, denser populated areas. But now you're starting to Toledo market, for example. Now you're starting to see the connect the dots situation where the counties between Toledo and Cleveland, between Cleveland and Columbus, between Columbus and Cincinnati, you're starting to see cases. You don't see too much south of Columbiana. You actually don't see much in Columbiana so far. In part, this is testing or lack thereof, and in part is report. So we're following a trend that is probably the norm. It's something to be expected.
How about our total numbers right here? Those numbers alarming you at all, or is it about what you would hope?
No, I would have hoped. I expected to see continue to rise. We all did. This effect of doubling and tripling. We've 90 some cases today. Every day seems like we go up by almost 100 cases. And our mortality, you have 6 deaths. Mahoney County, 23 cases. So we will continue to probably see this effect. But one thing that I have to, the caveat here is that we only know so much because we only have so many reported cases. So the ramping up of testing and reporting to the state is critical.
One of the things that we talked about, let's talk about one of those thoughts you had, which is the impact of this virus on younger people.
So the concern with the younger population is that we're seeing a median age now, and again, this is a range of the numbers starting to go down. It started at 48 years of age. We had a case from 2 to 9 to 80 some. Now we have cases from an infant with less than 1 to 93. The median is getting closer and lower and lower and lower. Now we're around 45 years of age. So what that means is that we're starting to see more cases in the younger population, only more cases, but also cases that do not end up well. And that's what shocked me about this. And it may be because it's early, but of all the total cases that have resolved, and when we talk about resolved cases, that means people who have gone to the hospital, got taken care of, got proven to have COVID-19 and went home versus cases in patients who passed. The curves are going the wrong way. Mortality is going up and survivability is going down. Even on those who survive, the main issue is how many of these patients will have chronic respiratory problems, how many of these patients will completely resolve. There's a increasingly inflammatory condition and just devastating to the lungs. So even if you survive it, how much lung function do you have left after you're done? And this is data that will go on in compiling it for months and years. And it's heated advice. If you're really smart about this, consider yourself infected so you can protect the people around you. Um, period.
Fascinates me how this whole flu situation works. You were trying to study this gene and this strain, and something weird happened on its way from China to Korea to Italy, and if it became something different than what it originally was in China. I wasn't sure exactly where the heck you were going.
If we've learned anything with influenza is that we can we can produce a vaccine that is based on the strains that have been recovered elsewhere during their winter. And then we use those here, and we may have 20, 30, 40% of patients who immunize, and the other 60% still get the illness. The difference is that we have seen influenza, we have been exposed to influenza every year. We've never been exposed to this COVID-19. So we have no way for our immune system to even have remotely a chance to mount enough of an inflammatory response or defense against it to keep it from getting in your lungs. The question is, has this thing mutated on its way here in a way that now it becomes a lot more toxic and a lot more of a killer rather than something that is giving people bad flus? I think exposure is the main event, but how our immune systems work, they don't differ. We're all human, I think.
Some of my golf buddies who are all geniuses, it talked about, why is everyone getting so worked up over this? The flu kills 70,000 people per year, and we're not even close to 70,000 being dead with this strain.
And we see influenza every year. We get exposed to influenza every year. People ask me all the time, how come you don't get sick? I mean, you guys, you doctors, you get sick? So yeah, we get sick. But over time, the immune system is supposed to respond the same way. You get exposed to something, you create some degree of immunity to it, which will help you the second time you get exposed to it, unless it has changed so much that now your immune system can't recognize it anymore. In this case, we've never been exposed to this.
What's your take on our governor and our health director and how they're managing it? We're currently under a stay in place, whatever terminology you want to use, shelter in place since tonight it starts, correct? I think
the state is pretty lucky to have the director of health that we have. Today I was concerned because I think she looks like it's getting to her. She's extremely bright and she's critical about herself more than anybody else, and she wants these labs and she wants these hospitals to get to her 1,100 employees, the information they need so they can start tracking down contacts and start cutting down. You can tell that she's just starting to get a little bit exasperated with getting the information she needs in order to do a better job. And she was very emphatic about the fact that if we don't do this, we're going to start seeing issues with your pharmacies and your grocery stores because people who work in these places are going to start coming up sick. We have to close the circle as quickly as possible and choke this thing down. Biggest dream would be to freeze everybody in place right now. If we were to freeze everyone where they're at and wake up 2 weeks from now, the virus would be gone. Can't do that. But we can hope that people will stay where they need to be, which is home, and consider themselves infected until proven otherwise. The governor is probably as professional as they come. He's doing as good a job as he can. He's listening. You can tell that he's following the advice of the experts. And if we could do these from now on as a nation, from the CDC or Fauci's office rather than at a podium at the White House press conference room, or newsroom, I think we'll be a lot better off, because now it's time to get the politics out of the way and let the experts handle this.
One of the cool things that's been popping up on social is that Dr. Acton, hailing from and being part of the Mahoney Valley medical community early on at the start of her career, YSU and Neomed. So what's the medical community been talking about with her appointment to the job, and obviously these last 2 or 3 weeks?
You know, what's something funny about the medical community is that the less you hear about them commenting about a colleague, the better the better they think about them. They're listening, they're following, and they're lining up behind her. And really, how lucky we are to have that kind of leadership. It's really easy to follow someone like that, and try to help in any way we can. Because not only is she educating the public and trying to keep them safe, but she's also leading us as primary care physicians on how to really do the best we can with this. It's not hard to follow someone who clearly has not only the best interests of all of us, but also is watching over the physicians and the nurses and the first responders and trying to keep us healthy and working in as safe environment as possible.
And right now, as we speak, there's 40,000 members of the Dr. Amy Acton fan club.
How hard could it be? I mean, how hard could it be? She has her family to be concerned about, and her family happens to be her immediate family plus all the Ohioans. That's what she's responsible for. And she has to take 1,100 people and send them to look into these cases, knowing well enough that any of them could get ill from doing their job. Now, that's just like sending somebody to battle. She's in charge of that. That's a lot of weight on your shoulders. And it doesn't take the faint of heart to be able to do that kind of job and keep her wits about her. And she's doing it.